When should you see a doctor for premature ejaculation? And how do you know the difference between a temporary setback and a real medical concern that deserves professional attention? This is a question many men silently carry, often wrapped in confusion, embarrassment, and self-doubt. Premature ejaculation is one of the most common male sexual health concerns in the United States, yet it remains one of the least openly discussed. The truth is that occasional early climax can happen to any man due to stress, anxiety, excitement, or even lack of sleep. But when it becomes persistent, when it starts to interfere with your confidence, your relationship, and your emotional well-being, it may be time to stop ignoring the signals your body is sending. If you consistently ejaculate within 1 minute of penetration, if you feel unable to delay climax despite repeated efforts, or if the condition has been present for more than 6 months, these are clear warning signs that deserve medical evaluation. It is not a weakness to seek help. It is a sign of maturity and responsibility. Sexual health is not separate from overall health. It reflects your hormonal balance, your neurological function, your cardiovascular system, and your mental state. When premature ejaculation causes frustration, avoidance of intimacy, or tension between partners, it stops being just a bedroom issue and becomes a quality of life issue. Many men delay seeking help because they believe the problem will resolve on its own, or they fear being judged. But medical professionals approach this condition with understanding, science, and discretion. According to experts like Dr. Mohit Khera, addressing sexual health concerns early can prevent unnecessary emotional damage and strengthen long-term relationships. You should also consider seeing a doctor if premature ejaculation develops suddenly after years of normal function, as this may signal an underlying condition such as thyroid imbalance, prostate inflammation, or psychological stress that requires proper assessment. If you experience pain, erectile difficulties, reduced libido, or symptoms of depression alongside early ejaculation, these combinations make professional consultation even more important. Your body communicates through patterns, and persistent change is never something to dismiss. A medical evaluation does not mean something is seriously wrong. It means you are choosing clarity over uncertainty. When you begin to understand that premature ejaculation is treatable and manageable, the fear surrounding it starts to dissolve. The first step is recognizing that seeking guidance is not an admission of failure, but a commitment to self-improvement, confidence, and healthier intimacy. Many men hesitate at this point, standing at the edge of a decision, wondering what will actually happen if they schedule that appointment, and the uncertainty itself becomes heavier than the condition they are trying to manage. The imagination often creates a scenario far worse than reality, filling the mind with fear of judgment, awkward conversations, or uncomfortable examinations. Yet a professional consultation for premature ejaculation is not designed to embarrass you. It is designed to understand you. When you walk into a qualified physician's office, the process begins with a detailed medical history, because sexual health is deeply connected to physical health, emotional stability, and lifestyle patterns. You may be asked when the symptoms began, whether the condition has been lifelong or developed recently, how often it occurs, and whether you experience control during masturbation, but not during intercourse. These questions are not invasive. They are investigative, helping the doctor determine whether the cause is primarily psychological, biological, or a combination of both. Blood tests may be ordered to evaluate hormone levels, especially testosterone and thyroid function, because even subtle imbalances can influence ejaculation timing. The doctor may assess for signs of prostate inflammation or other underlying conditions that could contribute to sensitivity or altered nerve responses. In many cases, no complex procedures are required at all, only a thoughtful conversation and strategic evaluation. What surprises many men is that premature ejaculation is highly treatable, and treatment does not always mean medication. Behavioral techniques, pelvic floor strengthening exercises, counseling to reduce performance anxiety, and lifestyle adjustments such as improved sleep, exercise, and stress management can create significant improvement. In certain cases, medications like selective serotonin reuptake inhibitors or topical anesthetics may be recommended, but only after careful consideration of benefits and side effects. The goal is not to mask the problem, but to restore confidence and control. However, here is where suspense quietly enters the story. Sometimes the symptom is not the main issue, but a signal of something deeper that has been silently developing. A sudden change in sexual performance may reveal chronic stress that has been ignored, relationship tension that has been unspoken, or even metabolic changes that have gone unnoticed. This is why timely consultation matters, because early evaluation can prevent small issues from becoming larger burdens. Experts like Dr. Mohit Khera emphasize that sexual performance is often a mirror reflecting overall health, and when you address the mirror, you begin improving the entire system. The consultation is not a final verdict. It is the beginning of understanding. It is a step toward reclaiming confidence rather than living in quiet frustration. And the greatest realization many men experience is that the fear of seeking help was far more intimidating than the actual process itself. What truly transforms a man is not merely receiving treatment, but recognizing that taking action redefines his identity from someone who silently tolerates frustration to someone who actively shapes his own well-being. Premature ejaculation does not define your masculinity, your strength, or your worth, yet avoiding it can slowly erode your confidence over time. When you choose to seek medical guidance, you are not admitting defeat. You are reclaiming control over your narrative. Too often, men carry the burden alone, convincing themselves that endurance means silence, that resilience means pretending nothing is wrong. But real resilience is measured by your willingness to confront discomfort in pursuit of growth. When a condition begins to influence your self-esteem, your connection with your partner, or your emotional peace, it becomes more than a physical matter. It becomes a call for awareness. There is power in understanding that premature ejaculation is a medical condition with identifiable causes and proven treatments. There is strength in realizing that millions of men experience similar challenges, and that improvement is not only possible, but highly achievable with proper support. The suspense that once surrounded the idea of visiting a doctor dissolves when you see the results of informed action. Confidence begins to rebuild gradually, not because perfection is guaranteed, but because progress becomes visible. You start to notice improved control, reduced anxiety, and a stronger sense of partnership rather than pressure. Guidance from experienced professionals, including voices like Dr. Mohit Khera, reinforces the principle that sexual health is an integral part of overall health, not a separate or shameful topic. When you approach it with maturity and openness, you create space for healing rather than hiding. The journey may require patience, discipline, and honest reflection, but it also offers the reward of self-respect. Imagine the relief of no longer questioning whether something is wrong, no longer searching late at night for anonymous answers, and no longer avoiding intimacy out of fear. That relief begins the moment you decide that clarity is more valuable than comfort. Your health deserves attention. Your confidence deserves protection. And your relationships deserve the stability that comes from proactive care. Seeking help is not a dramatic step. It is a responsible one. It signals that you value your body, your mind, and your future. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.